Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. Going to talk about pantoprazole, the potential side effects with pantoprazole. We're going to talk about the short-term and the long-term risks associated with this medication. Remember, this video, as with all my videos, information, not advice. You need to talk to your healthcare provider before you make any changes to your medications, lifestyle, dietary. Okay, so the topics covered in this video, we're going to quickly discuss what is pantoprazole. We're going to talk about using it, the short-term uses versus the long-term uses, um, things that you can do to reduce the chance of side effects. The most common side effects, or what we classify as the short-term side effects, and then we'll talk about some of the concerns about when these medications are used long-term and the potential side effects that can occur due to that. First, what is pantoprazole? Pantoprazole is in a class of medications known as proton pump inhibitors, or PPIs. Other popular PPIs include omeprazole, esomeprazole, things like that. What they do is they decrease the amount of stomach acid. They reduce the amount of acid produced in the stomach. Pantoprazole in the US is sold under the brand name Protonix. These are very effective medications. They are very good at reducing the amount of acid produced in the stomach. So they certainly do what they're supposed to. And most people do tolerate them well, especially when used short term. So what are some of the short-term uses of pantoprazole and all the proton pump inhibitors? GERD, gastroesophageal reflux disease, especially with erosive esophagitis, generally for up to 8 weeks. Stress ulcer prevention. We often see pantoprazole and other PPIs started when people are in the hospital or critical care, just due to that stress. That's a stressful environment for the body. The medications like this are used to prevent ulcers from occurring in that situation. Dyspepsia, usually pantoprazole, not the first one reached for this. That's just your generalized stomach issues, heartburn, that sort of thing. No more than 4 weeks when used for dyspepsia is the general recommendation. H. pylori treatment, that is a bacteria that can grow in the stomach that actually causes heartburn issues. That's treatment is generally 14 days. So it'd be pantoprazole along with a couple antibiotics, usually ones like clarithromycin and amoxicillin, but may vary depending on your doctor. And ulcer healing. So it would find out you have an existing ulcer, medication like pantoprazole used for 4 to 8 weeks to assist in the healing of that stomach ulcer. Long-term uses, we're looking at excess stomach acid produced all the time. Zolling or Ellingson syndrome is a hyperacidity, or where they're just making too much acid all the time. Preventing ulcers due to NSAIDs. NSAIDs are non-steroidal anti-inflammatory medications, things like naproxen, ibuprofen, meloxicam. If you're at high risk of getting an ulcer, or if you've had an ulcer and you need to remain on an NSAID, often coupled with a proton pump inhibitor like pantoprazole. Simply, if you're going to need the NSAID, you're going to have to reduce that risk of a bleeding ulcer. Erosive esophagitis when the symptoms continue. So if you failed that first 8-week therapy for esophagitis, oftentimes you may need to go to long-term use of this. Of course, you want to make sure you talk to your doctor about that. Stomach bleeding, and you're on something to take, you take something to prevent blood clots. So you're on some sort of blood thinner or antiplatelet medication. You've had some stomach bleeding issues, but you need to remain on that. Sometimes proton pump inhibitors like Protonix will be added. Barrett's esophagitis, another hyperacidity condition. All situations where long-term therapy does seem appropriate. So we want to avoid side effects. How do we do that? It is estimated only 1 in 3 people need to use this like proton pump inhibitors long term. So unfortunately, people get put on these and they don't get taken off. So that's a conversation you may have with your healthcare provider. See if you still need this medication, or if what you've been using it for is kind of under control and you can go on a lower dose. Again, we want the shortest duration at the lowest dose possible. These medicines are very good at what they do, but like any medicine or treatment, the shorter duration you use it, the less likely you'll have side effects. Dietary and lifestyle changes can do a lot to improve many of these acid conditions. Personally, I know when I lost about 15 pounds, my heartburn disappeared. But that's not the situation for everyone. So again, that's something you talk to with your healthcare provider. They can determine whether there are any appropriate lifestyle or dietary changes you could make to kind of improve your symptoms. And taper dose. Unfortunately, these medications will sometimes cause a hyperacidity or kind of a rebound acid production when you stop them. So a lot of times the dose needs to be tapered. So you go down to the lowest dose and then every other day, and then maybe use a weaker medication like ranitidine or Zantac or Pepcid, famotidine. One of those, just kind of step down off of this medicine, because a lot of people, they try going off of it and they're like, whoa, my acid is back worse than before. And that does happen. That's, I think, where we get these people staying on these, is they stop taking it and they're like, whoa, I still need this. But with your doctor's help, you can kind of taper that dose to effectively get off this medication. Most common side effect, headache. About 14% of people report they can get a headache. Some other of these we would consider the short-term side effects. They can occur anywhere from 1 to 10% of people. Some people get some swelling, dizziness, vertigo. Depression has been reported. You can get skin rash, itchiness, increased sensitivity to the sun. I've not seen the sun sensitivity a lot, but you have to be careful with any medication. Vomiting, diarrhea, stomach pain, constipation, flatulence, nausea, all those things can occur, especially on medicines like this that influence the digestive system. We see a lot of that. Increased liver enzymes, not super common, but can happen. Muscle pain, fever, blurred vision. Of course, if you ever feel like you're having a side effect, you need to contact your healthcare provider so they can kind of rule that out, maybe change to a different medication. Just the sooner you catch it, the sooner you open that conversation about a potential side effect, the less likely that it's going to cause any long-standing issues. Long term, so typically the long term, depending on where you look, is more than 8 weeks, or some studies even say less than a year is like long-term use. And so we tend to see these side effects after you've been on a medicine like this more than a year. Low magnesium, the change in the stomach pH, the acidic environment of the stomach, does seem to affect the absorption of certain nutrients like magnesium. Hypersecretion or rebound acid, we talked a little bit about this. When you go off this medicine, your acid production is higher than it was before. Does seem to be a risk of, it's hard to know for sure on some of these medicines. Some of the studies suggest there may be a higher risk of pneumonia or other respiratory infections. Again, the acid in our stomach is protective. It helps protect against infections. That acid kills a lot of bacteria. And it does seem like there may be an increased risk of pneumonia. Serious stomach infections, ones known as C. diff or Campylobacter, those can occur. Again, I'm sure that has to do with the decreased pH or acidic environment of the stomach, so those bacteria can survive. Increased risk of fractures. There does seem like there is a chance, especially like wrist and arm. I think the studies have kind of shown there's definitely a risk there. Again, probably after being on this type of medication for years. And a vitamin B12 deficiency can occur, again, like we touched on with magnesium. So remember, we're going to just summarize here. We always want to, when using proton pump inhibitors like pantoprazole, the lowest dose for the shortest time. And it's best not to stop abruptly, especially if you've been on it a long time. Typically, your dose will need to be tapered. And always consider lifestyle changes. That's something you need to talk to your healthcare provider about, and they can help you determine which lifestyle changes are appropriate and the best way for you to enact those. I do appreciate you watching. Remember, talk to your healthcare provider if you have questions about your medications. Ask questions below in the comments. I'll do my best to answer them. And subscribe to my channel. Thanks for watching.